So one of the conditions that we treat often in my office is heel pain. Heel pain can be caused by different things. It can be caused by a nerve problem in the heel, it can be caused by inflammation in the bottom of the foot, or it can be caused by conditions like arthritis. Most of the times, the cause of heel pain is an inflammation in the bottom of the heel. In the bottom of the heel, this is a foot model, and this is an x-ray. We have a ligament that runs from the heel all the way to the toes. And that ligament, that is called plantar fascia. And when that is swollen, it's called plantar fasciitis. That is the most common cause of heel pain. Under normal, another cause of heel pain is nerve entrapment. We have a nerve that runs this way, and that can be entrapped, and that can be the source of heel pain as well. And then other conditions like arthritis, rheumatoid arthritis, can cause heel pain. So when patients first come with symptoms of heel pain, we have to narrow it down. We have to find out what the cause is. And as you can see in this x-ray, we have this right here, which is called a heel spur. Normally, the bottom of the heel should be nice and round, but over here we have this spurring. So there has been a lot of stress going on in this heel, which is most likely secondary to the stress, the tensed plantar fascial band that runs this way. But in this x-ray, you can see also one other thing too, which is interesting, is that the patient is completely flat. There's no arch. Normally, this should be triangular in shape, but this one is flat. So she's putting lots of pressure, she or he is putting lots of pressure on areas that there shouldn't be any pressure, and that can develop pain. So, and that's how we have to target the treatment. We target the treatment depending on what the condition is and what can be causing the heel pain. So if a patient doesn't have an arch, what we want to do is give her an arch support, an insert, but something that is sturdy enough that's going to hold the weight, is going to help position this this foot into an arch type of position. And the way we do that is by making the patient a custom orthotic, which is an insert that goes inside of the shoe, custom to the size of the patient's foot, in order to capture the anatomy, in order to help fix this position of the arch. If the problem is from the heel and there's a lot of inflammation around the heel spur, many times we'll perform a minimally invasive technique, which we can do here in the office, where we go and make a little stab incision in the bottom of the foot, and we go and we use the fluoroscopy machine, which is an x-ray machine, and we shave it down. And we put a couple of stitches, and that's it. And by doing that, we relieve the tension in the plantar fascial band. But those are surgical treatments. First, of course, we want to treat the patient conservatively, which is the use of the custom-made orthotics. We also do laser therapy for heel pain. We do the laser in our office, and we also perform shockwave therapy. All these things help decrease the inflammation and pain, but first, very important, we have to find out what is the cause of the heel pain. In kids, sometimes we see something that's called calcaneal apophysitis, which is inflammation and pain in kids' heels. And the reason they get that is because they're growing. In our bones, all our bones, when we're kids, have areas where they're open. The bones are open in these areas. They are called growth plates because that's where the bone grows. And a lot of kids, when they're doing sports, they stress this area a lot very frequently, and they develop this pain, which is caused because of the growth plate becoming inflamed because they're very active, they're doing sports, they're tensioning the Achilles tendon, and all that tension, if they're not stretching enough, can cause the heel pain. So for further information, go to our website where we talk about some of these conditions, but if not, give us a call.